Hi guys, I just wanted to give you an update on my progress again. Today I had my stitches removed, which is a huge day, so I'm super happy about it. And they are super small. I think I already shown you before, but I will just show you quickly. That it's basically 3 little points on my tights. So I think they are not really gonna be visible in the future, and I got some good advices of what cream to use to make them disappear completely. I don't want them to disappear completely because they are the part of my healing journey, if I can say this, and I'm super happy that this has been done, and my progress is going better and better. So this is Thursday, and I had the Thursday the 4th of July, my dad's 70th birthday, and the surgery was on the 24th of June, so around the 9th, 10th day that we are now. And everything is going well. Yesterday and the day before I was walking with and without my crutches, and this morning when my friend came and took me to the doctor, I decided not to use the crutches anymore because I think it's super important to use your own strength and to heal the hip. And I went to the doctor. He removed the stitches, and I had the first proper shower today, when I could like stand under the shower and have the whole water slide, like the whole water coming on my body, which was amazing because I was watching separately my upper body, my lower part of my body and everything. So today was a great experience to have a shower again properly, and I'm feeling great. The walking went really well, and yesterday I went to the gym in the afternoon, and I made a proper, I did a proper upper body training with pull-ups again, and with lateral raises, with push-ups, with Arnold push, with all kind of different stuff that I really like, and I think it gives me a really good sensation that I can still work my body. And really yesterday, even in the gym, I was half on my feet, half on crutches, because I wasn't 100% sure if I can do the walk home without crutches. It's not too far. It's like it would take probably, I don't know, 5 minutes if I wasn't as slow as I am now by walk from home to the gym, but now it took like I'm walking slowly, so it takes like 10-15 minutes to get to the gym or coming back from the gym. And I still keep taking the L-lysine and the glutamine amino acids, which I mentioned earlier, that are really good for healing the wounds. And I'm also taking one prescribed medication, which is an anti-inflammatory medication, which my doctor mentioned that I have to take for 4 weeks. I'm over on week 1 now, so that's good. Work-wise, I'm very lucky because I really have an amazing workplace, and my bosses and my colleagues are just, I'm speechless because they are all wonderful. My colleagues are totally by my side, and as I mentioned in my earlier video, I cannot drive yet. The beginning of next week I will do. I will try, and I think I will be able to, because my leg is getting stronger and stronger every day, and I can tell the way I use it, and it's a great experience. And but this week my colleagues are taking turns who is taking me to work and who is taking me back from work, so whoever is going there or coming back, I just asked someone, and they are all super helpful and super nice, and everyone told me before as well that I can ask for help anytime, and I don't feel bad about it, because I see that they are really happy to help me out on this front. And seriously, everyone is very helpful. I don't do a full week of work this week. I do, but not the way that I work 8 hours per day. I go to work, I can spend more or less a couple of hours on my booty, sitting, but like standing up all the time and sitting and arranging stuff and things like that, and after it's enough. And luckily we have we have a huge lounge, and there is like a tall table, and I can stand, sit, and do whatever I want there, because it's really good for my size. It's actually the size where my chest is, and so I can easily use the computer there. My laptop I take there usually, so after 2-3 hours of sitting on my desk, I'm just moving to a different place, and then I'm walking, and I'm doing my job at the lounge, and continue my work there. And then normally this week I worked only for 5 hours per day, but seriously, I cannot complain. Everyone is very, very sweet, and my bosses are super sweet about this situation as well. So they don't make me feel uncomfortable about the situation that I work less, because other times I'm working more anyway. So I think it's a nice balance between being off sick and between working and understanding the situation that I'm in. So I think it's a nice give and take in both ways. And anyway, I'm happy in any way. So that's a huge help, and I have really great friends at work too, so that's good. And then that's all I wanted to say. So I walk on my 2 feet now only, without crutches, on day 9 of my recovery journey. I'm not saying that it's easy. I still don't have pain, I have to say this. No pain. I would say when I'm sitting on my booty, it's a little bit uncomfortable. It's like when you're sitting on an airplane for 10 hours and you feel that it's too much. Now it comes for me after a couple of hours. So just really taking it easy, listening 100% my body. So when I feel it's too much, I just stand up, I walk around, I go for a walk, I go to this other desk, and when I feel tired, I ask one of my colleagues to take me home, because I know I feel when it's not comfortable at all in any position, so I need to lay down and just rest. But I have to say, I can see a really nice progress from Monday till Thursday. Monday, I felt it very quickly. Tuesday was a tiny bit more that I could do sitting, and Wednesday was even more. And today, it was quite good, but still not 100%. And when I feel I'm done, and everyone understands it, and I'm still replying to emails when it's necessary, or arranging things when it's necessary. But still, if it's over for my body, it's over for my body at work. And it works really well that I listen to it, I move back, I do whatever I need, I lay down, I just chill, and then it gets better. And Monday when I came home, I was so tired. I just felt like I cannot stay awake anymore. So I came home after work, laid down. I was like, okay, I'm gonna meditate a couple of hours, and then I woke up in the evening a few hours later, the same Tuesday and Wednesday. Yesterday I felt very tired, but I wanted to go to the gym where there was not many people, so I went earlier, like 2-3 in the afternoon, because I knew around 6 o'clock it's gonna be like crazy, and I didn't want to be there when it's like peak time. So I finished by peak time. I still done a really good upper body session, and I still done 1 hour of cycling with small resistance. So, and you know, I thought maybe it's gonna be too much, but then today I was thinking it was really good that I done it yesterday, because today my leg felt much stronger, and I felt confident to walk on my feet. So I walked to the clinic with confidence, and even at work, and people were like, what, you are already in your feet? And I was like, on your feet? And I was like, yes. Well, you don't have to imagine like I'm making big steps and I'm like running and going all over the place. Small steps, slowly. So it's like a little bit of limping still, so I still have like this kind of movement, but it's just that I have to get used to be able to use my right leg properly and charge it. So my brain has to remember that I can charge this leg properly, and that I can use it. And I'm very lucky that it's only like a few days, like under 10 days, that I used crutches, because someone who is using crutches for like, I don't know, I saw videos on YouTube with the same problem for like months, is using crutches, like so many weeks, 2 months or something. I mean, imagine that your body gets used to completely, I don't know, balance out the imbalance of your body differently. Must be hard to get back and charge your leg. And to be honest, yesterday I was on the bike, and before, when I moved up my leg, my right leg, above 90 degrees, I had the feeling that, you know, I had to turn it a little bit on the side way, because I knew this is going to be very uncomfortable. And yesterday I noticed that I did it again, and I was thinking, wait a minute, now you don't have to do this, because the leg works properly. There is no pain when you do over 90 degrees. So it's just the matter of your brain compensating the pain, and gets used to the really normal way of moving. Because for me it was 8 years that I compensated, and it's amazing that it moves as it should be and as it was before, and it's crazy happiness. So what else I'm thinking, what else should I say? There is nothing else I can think of. Just gratefulness. I'm super incredibly grateful for being able to move my leg as I can now, and to be able to walk without crutches. And I know this is the second week, so this week, the next week, and the week after are absolutely crucial of how will I handle the healing and the charging of the weight on my legs. I cannot exaggerate and believe that, oh, now I can do everything just because I feel good. So I have to remember, and you have to remember, if you're in the same situation, that these are the most sensitive weeks, and you have to keep quiet. And even though I went to the gym 3, 4, 5 times a week, I can only go 2-3 times, and not going on the treadmill. Like on the weekends I always went on the treadmill, because that was my time, you know. I was like, yes, I have 2 hours or 3 or whatever I want to spend in the gym. My warm-up was an hour on the treadmill, and that was, well, that's only on the weekends. I have to calm down and think, no, it's just I can do 1 hour on the bike, like on the home bike type of, you know, cycling. But when my body says it's enough, it's enough. So, and because I hurt myself quite a few times with overdoing the gym, like when I had my stress fracture in my femur when I was running 2 hours a day between Nice and Monaco, when I used to live there, almost every day, or at least 4 or 5 times a week. And then when I had the stress fracture and I was completely stopped doing all the sports, I still went to the gym and done upper body, so I overdone it, and I had an operation because my muscles, my ligaments started to suffocate the nerve in my arms because I was doing too much upper body because I couldn't do any lower body exercises. There is a limit, and I learned that in a couple of surgeries price, but I did learn. So the thing is that you have to listen to your body, and now I have to really just go with it. And this summer, before I had the operation, I knew it's gonna be about limits, so I can do lots of other things, but less sport than usual. And I can appreciate it. I appreciated it anyway, but I love my sessions, and I thought without running or without lower body it's gonna be very difficult. I still do lower body, but I do the physical therapist exercises basically with my leg, but with small bands, small plastic bands. So like it makes it much harder. Like the black one is the hardest, and I usually do it with the black ones because that gives like resistance, and it gives a peace of mind that my body is still working it, so I can do what I can. So that's what I wanted to say. I wish you a very, very, very quick and successful recovery. And yes, it exists, and you get off the crutches very, very quick on day 9, 10. If the doctor says so, and if the situation is not as bad. So I hope everything was the best possible way for you too. Thank you. Bye.